Hi, my name is Max Williger. I'm an optometrist at the Virginia Eye Institute. So I actually started as a researcher. I started in the lab doing glaucoma research. And I realized pretty quickly that research requires a very particular type of personality. It requires a lot of alone time. It requires you to be by yourself for a long time. And while the work was very interesting, ultimately I realized that I get a lot of my motivation from people, from being around people, from forging relationships with people, and from being able to help problem solve for people. And ultimately that brought me to the clinical side of eye care, and that's how I became an optometrist. I earned my undergraduate degree in biological sciences from Kent State University in Ohio. After that, as I said, I went into research and worked at Northeast Ohio Medical University doing glaucoma research in their Department of Neurodegenerative Diseases. Realizing that I would do much better on the clinical side of things, where I was dealing with people directly, I transitioned into a position where I was an ophthalmic technician at a practice not dissimilar to Virginia Eye Institute in Ohio. And I think that experience there is what ultimately drove me down to Virginia Eye Institute, because I had such a great experience in that sort of environment. I earned my doctorate of optometry from the State University of New York College of Optometry, after which I did a residency in primary care and ocular disease at the Harbor Health Hospital in Brooklyn, New York. So I have a special interest in ocular disease, specifically glaucoma, which is what brought me to the field of eye care to begin with. And working at Virginia Eye Institute, which is multi-specialty practice, is really special and means that we can have that continuity of care when a patient that has a disease that requires more complex management. We have the specialists here who are able to, continue that care with them. I approach optometry from a collaborative care standpoint. I think it's very important that we're all on the same page as far as goals and plan of care and treatment. I do my best to also educate patients so they know, what it is that we're treating, why it's important, how it's possibly going to affect their vision or their eyes or their general health. I think it's very important that people understand what is happening inside their own eye, inside their own eyes, inside their own body, so that they can be a part of their own care, that we work together as a team, and it's not me telling you what to do. It's a collaborative effort. One of the things that really drew me to Richmond was the rich outdoor life. I really enjoy hiking, spending time running, swimming, all sorts of outdoor activities. If you're having problems with your vision, please come and see me. You can schedule an appointment today.